Hello Enid, I am Diana Hernandez, Communication Assistant for the City of Enid, and with me is Community Engagement Director, Maggie Jackson. Maggie, thank you for being on.
Thank you, thanks for having me.
Okay, so you bring us updates, and so let's jump right into COVID numbers. What are they?
Sure, so just a quick update, COVID-19 is still here in our community in Enid. So we can pull up just our numbers that I pulled today. So total, we've had 7,445 people that have tested positive for COVID-19. In the last month, we have had an additional 23 deaths. So 69 people have passed away in Garfield County from COVID-19. But our active cases are down. We just have 281 cases that are currently active right now. So on the next picture, we can kind of look at the average trend. So as you can see in November, there around Thanksgiving, we had that big spike. And, an up and down throughout the holidays. And then since, the end of January, beginning of February, we have really seen some decline in our trend of COVID-19 cases. So this is encouraging, and we are starting to see what we believe, there's a lot of variables involved with COVID-19, but we have now vaccinated over 7,000 residents of Garfield County. Garfield County Health Department has given out 15,000 vaccines. We're doing lots of shots, and so 7,000 residents, that's really great. It represents about, I think it was about 50% of our adults over 65 that live here in Garfield County have been able to get a vaccine. Not everyone has gotten their second shot yet. About 25% have gotten their second shot. So half of our seniors have received a vaccine, which is so great because that's our our population that's at a higher risk of having severe illness from COVID. So we're just excited to keep rolling out the vaccine because we feel like we know that it's going to be a big part of seeing a decline in our COVID cases and see this pandemic get better. We're all ready to move on and kind of have some normal life again. So vaccine is our main thing that the health department is prioritizing. Excuse my mask is falling. We've been doing testing all year. We've been, still doing our other services and trying to keep juggling all the balls. But vaccine is our top of the list right now. So someone pointed out we haven't been posting a lot about as other topics, but we still want to encourage everybody to be healthy in other ways. And very much want to encourage you to get tested if you're sick for COVID-19. But you'll see on our Facebook page, we're mostly focusing on vaccine. All our staff are being deployed to help with the effort. We're there every single day at the Oakwood Mall. So it's been busy. The chart that you see right here is our phases for Oklahoma for rolling out COVID-19 vaccine. So we're in phase 2. And on Monday, teachers and folks who are under 65 that have a comorbidity. So a comorbidity is something that puts you at a higher risk of severe illness from COVID-19. So those are things like heart disease, diabetes, obesity, kidney disease, liver disease, or respiratory conditions. Those are some of the main reasons that you might be more at risk for having a worse case of COVID. So those folks are next in line, which is really exciting. So it's millions of Oklahomans that will now be eligible Monday to get an appointment for a vaccine. So what we know is it's been tough making sure our seniors get an appointment in the website. And this group, we're asking them to be patient with us too. We're doing some special events for teachers so that they have an opportunity to get an appointment and get vaccinated. And those appointments will continue to open up when we receive the shipment of vaccine. So it comes to us typically earlier in the week because of the weather. We have not, we're still waiting on our shipment for next week. It's on the way. But you won't see appointments on the website yet. I think the next slide has a reminder about vaccinate.oklahoma.gov. So this is where you go to register for a health department vaccine appointment. And if you think of it like a pre-registration, so anybody can go ahead and put in their information securely, and when they're eligible, so many people will be eligible Monday, they will get their email that has a link to book an appointment. Those who have tried, they might not see an appointment available today because we haven't put them in the system yet. But if you're in the categories of teacher from pre-K through 12th grade, or you are an adult and you have some type of those comorbidities I listed earlier, go ahead and register. You do need an email that works or someone to help you that has an email. So that website's open to everyone to pre-register. So think of it as like you're registered and then you'll be notified when an appointment's available. So we're excited to finally move to those groups. We know there's still some seniors that really, folks over 65 who need an appointment. Don't give up, keep trying. We're gonna do lots of second dose appointments this week because we're trying to make sure everybody gets their second dose of the vaccine that they need. So be patient, we keep adding appointments every week. And like I said, we've done 15,000 shots. So one of the reasons why you might have had trouble is just the sheer volume of people we're getting through. So still very thankful for the Oakwood Mall, for all of the partners who have been helping us. We've had so many volunteers. They've been amazing. Once you get your appointment, this is the map of the mall. We're there in the northeast side. Still, it's where the Spirit Halloween store was, and it's a huge space, so we're so fortunate to not have lines outside. You get to come in, we get you checked in, and you won't have to wait hopefully too long. We're still asking people not to walk in. We can't take walk-ins. We use appointments so that we make sure we have a vaccine when you come. So if you're still having trouble, maybe you know someone that doesn't have the internet, please help them, help your neighbors, help your family members. But if someone doesn't have the internet, doesn't have an email, they can call. On the next slide, we have our phone number again. It's 580-233-0650. That's the local health department. Or they can call 211. And 211, I know some people had tried before and it was really busy. Now they're really helpful. They can actually make an appointment for you, or at least get you started. You have to get through a couple robot, answers, a couple button pushes, and then you get to a person who can help you out. So don't give up. Give it a call. They'll help you out. And otherwise, be patient. We'll be adding appointments every week. And we'll try to keep you updated on our Facebook page for what we're up to. So those are my main updates. For COVID, we think the vaccine is, such a, it's going to be so helpful in preventing the spread of the virus. But we're still asking people to wear your mask and wash your hands and watch your distance. We know that those things are still going to be needed, especially the next few months, just because you've been vaccinated. We're not 100% sure that you can't potentially transmit the virus. We think it really helps and it's really going to be effective for slowing the spread, but we still want you to take those precautions. The CDC did update if you have had both doses of your vaccine. So Moderna or Pfizer vaccine, if you've had both doses and you have had about, I think it's 10 days after your second dose, 2 weeks to be safe. I go with 2 weeks because for sure that you've built immunity and you have no symptoms. So if I'm exposed to COVID-19, I've had 2 doses of my vaccine, you are not, it's not going to be required to quarantine. So that's a big update for folks. So if you've been exposed to COVID, but you've had your 2 doses of vaccine, you may not need to quarantine. So that hopefully will help, especially students in schools that are having to miss school, and students don't get vaccinated, but their teachers and family members that are impacted by quarantine, that update is going to help a lot of folks too. So if you're eligible next week, try to get an appointment. We really want to see as many people as we can, as quickly as we can, because we want to get to that herd immunity. We want to get to where our most vulnerable people are protected. And that takes all of us. It takes me, it takes you, to protect those who are most vulnerable. So that's most of my updates. We want to make sure you know that if you have an issue getting a ride to the mall, the City of Enid has also provided transportation service. So if you know someone that maybe can't get there but has an appointment, have them call 580-233-RIDE, R-I-D-E, 233-RIDE. We have seen several people utilize this service, and it's been so helpful to make sure they can get to their appointment. We would love for you to be able to call that number so you can come see us at the mall. That's all I have, I think.
Thank you, Maggie. And I don't have any questions online. And do you have anything, closing thoughts or comments before we close out?
Sure. Just thankful for this platform. Thank you for all of those who've listened and for your support. We've had so much encouragement and thankfulness. People have been bringing the volunteers food at the mall. It's such a great thing to have the community really rally around this effort, and just so thankful for this community that's really been supportive.
Awesome. So thank you everyone for watching, and join us for another community health update in 2 weeks. So thank you and stay safe.
Thank you.